So we have public health insurance programs in the United States. Medicare, that is not this one, Medicaid. Medicaid is a publicly funded health insurance program, generally for low-income people. It was created in 1965, the same year that Medicare was created. And here's the deal. There are some big federal requirements for how the program has to be run. But it's elective. Not every state has to have, no state has to have a Medicaid program. If a state chooses to have a Medicaid program, it has to follow the federal requirements. In exchange for following the federal requirements, the federal government always pays a fixed percentage of the cost, no matter what happens, no matter if there's an AIDS crisis and a ton of people get too sick to go to work, no matter if there's a great recession and people lose their jobs, and which is our primary way of providing people health insurance in the United States, or there's a global pandemic. So the federal government always pays a fixed percentage of the cost, and that fixed percentage is never less than 50%. And in some instances, it's far higher. For some populations of people that the program covers, it's at this date currently 90%, 90. So that fixed percentage, you'll hear that a lot in policy conversations, is called FMAP, the Federal Medical Assistance Percentage, or FFP, Federal Financial Participation. It is mandatory spending. It is not part of the annual congressional budget because it is in federal statute and it's an entitlement. If someone is found eligible for Medicaid, they have to be provided Medicaid services. Congress can't stop those dollars from leaving, and neither can the state house, right? So the only mechanism that they have for essentially curtailing Medicaid spend is frustrating enrollment. And one of the features of Medicaid is that for standard Medicaid, you can't cap enrollment. If you need it, you get it. Okay, so public health insurance program for low-income people. Big federal requirements, but it's administered at the state level. If you play by the Fed's rules, they always pay at least half, and sometimes much, much more. Okay, so this is a pie chart of our Medicaid program in New Hampshire right now. And these are done by me lumping together some general eligibility groups. So the two biggest slices of the pie are low-income kids at 46% of our 184,000 people in New Hampshire who get Medicaid. And another 58,000, the second runner-up is 58,000 adults who are called our expansion adults. You'll see that about 13% are older folks and people with disabilities. And then there's about 8% that are pregnant women, former foster care kids, other non-disabled adults, and then some kids who have really, really deep needs. Their disabilities are profound enough that they qualify for in-home services. Okay, so our single largest eligibility category is children. And our second largest eligibility category are these expansion adults. So just to walk us down a little bit of history lesson, historically Medicaid provided coverage to these four groups of people. In 1965, can you think about what all these people had in common with respect to employment? They didn't, right? Or they weren't expected to. Culturally, they didn't work or they weren't expected to work. Or in some cases, we still to this day do have child labor laws on the books, right? Kids weren't allowed to work. So there was no way to, and employment is the primary way that we connect people to health insurance historically, traditionally in the United States. So there was no other, if there was not a breadwinner in the house, or if there was not an employed person in the house, there was a program designed to connect them to health insurance. Okay? So typically in Medicaid's history, these are the groups of people who have been covered by Medicaid. Infants and kids, expectant moms, older adults, people 65 and older, and people with disabilities. So what low-income person, so you had to be low-income and generally in one of these categories. So what low-income person is not in one of those buckets that you can think of? Right. 19 to 64, low income. Right? So that's the expansion adults. That's the people in the light blue pie slice. Spoiler alert, most of the enrollment frustration initiatives fall on them. The vast majority. Okay? So that's sort of a silver lining, I think. This, we don't need to talk about that. Okay, so in every county in New Hampshire, except for Rockingham County, 10% of the population, at least 10% of the population is covered by Medicaid. Every single county. Okay, and in some counties it's more than that. And New Hampshire in total covers about 13% of the population through its Medicaid program, which is a relatively low percentage compared to the rest of the states in the union, but is not the lowest. I think I have on this, North Dakota and Utah have a smaller percentage of their population that they cover through their Medicaid program. Okay, so back to what I was saying before. So the reconciliation law reduces Medicaid spending by frustrating enrollment, it imposes work requirements, more frequent eligibility checks, it increases cost sharing, and it actually outright ends Medicaid coverage for many lawfully present immigrants.